Hello, I'm Dr. Gina Thornton-Evans, and I'm a Santa Fe Group Senior Scholar. I've spent nearly 30 years of my career dedicated to federal service and have focused on data collection efforts at the national and state level. This includes monitoring oral health outcomes across the United States and assessing trends over time, along with examining dental utilization focused on dental visits in the past year. This effort aligns with the Santa Fe Group's mission to advance oral health for all. The Santa Fe Group works to increase awareness of the need of oral health across the lifespan, especially among older adults, and the inclusion of medical dental integration efforts to advance oral health. You may be aware of the following: dental care costs and economic impact. In 2023, $173.8 billion were spent on dental care. Associated productivity losses were estimated to be $59 billion dollars. Compared to medical, prescription drug, and other healthcare categories, dental care has the highest reported financial barriers to receiving needed care. Periodontitis and diabetes. Periodontitis, a chronic inflammatory condition that leads to destruction of the supporting tissues around the teeth, is a leading cause of tooth loss. Diabetes, which affects about 38 million U.S. adults and is the eighth leading cause of death, is a risk factor for developing periodontitis. About 60% of U.S. adults with diabetes have periodontitis. Reduced hemoglobin A1C levels among persons with diabetes has been associated with lower risk for diabetes-related complications, including diabetes-related death. There are also studies that show evidence of a bidirectional relationship between periodontal health and diabetes management. That is, inflammation from poor periodontal health can worsen glycemic control in people with diabetes, and poor diabetes management can worsen the tissue damage seen with periodontitis. Periodontal treatment among those with diabetes and periodontitis improves glycemic control by a clinically significant amount, lowering hemoglobin A1C by about 0.43% 3 to 4 months after treatment. In addition, there are a growing number of studies that show people living with certain chronic conditions more often have untreated oral diseases or conditions. While oral health affects our ability to do things like eat, speak, and smile, oral health is also connected to our overall health. Studies find that there are higher unmet dental needs among adults with chronic conditions and also suggested missed opportunities for integrating oral health services and referrals in medical and community settings. The Santa Fe Group has been a champion for increasing awareness and providing strong evidence to include oral health as a standard of care for those with chronic conditions. Through inclusion of oral health in prevention and treatment approaches, as well as inclusion as a standard in insurance coverage. In addition, among U.S. adults aged 20 years or older with multiple chronic conditions or poor to fair general health have worse oral health, including a higher prevalence of periodontitis or gum disease, untreated cavities, or sometimes called tooth decay, and severe tooth loss. As I mentioned earlier, about 60% of U.S. adults with diabetes have periodontitis, a type of gum disease that is a leading cause of tooth loss. If left untreated, periodontitis worsens glycemic control among those with diabetes. Periodontal treatment can improve glycemic control, and diabetes management can help support periodontal health. More than half of the U.S. adults with multiple chronic conditions, or those that have diabetes in particular, had a past year medical visit, but no past year dental visit. Adults with no past dental visit have a higher prevalence of periodontitis than those with a more recent dental visit. In closing, being a Santa Fe Senior Scholar has been an honor and a privilege as the Santa Fe Group and its members, along with the scholars and fellows, work to support the enhancement of oral health strategies and the improvement or advancement of oral health across the lifespan, along with promoting the importance of oral health to overall health. This is Gina Thornton-Evans, Santa Fe Group Senior Scholar, on behalf of the Santa Fe Group.